Jessica, do we have everyone from staff that we are supposed to have on the call?
We do. It's mostly just Emma and I today presenting.
Okay, then let's go ahead and get started just in the interest of time. And when Councilmember Murillo is able to hop on, we'll have her hop on. But for now, I will call to order the March meeting of the Housing, Neighborhood, or Community Services and Redevelopment Policy Committee. And we'll start with the approval of the minutes. Councilmember Medina, do you have any changes?
No, thank you.
Okay, I do not either, so those will stand approved as written. Oh, and I always get this in the wrong order. Next, we'll do announcements.
Councilmember Coombs, I don't think we have any announcements, just kind of a apology for the agenda coming out so late. We had a tight 3-week turnaround between the next meeting. So the next meeting, we should be on our regular schedule then with deadlines and the agenda out a week in advance. So just wanted to acknowledge that.
Thank you so much, and thank you all for being flexible in kind of getting the schedule situated in this first part of the year. We appreciate that flexibility. So thank you for that, and we totally understand the, that really compresses your timeline, so no problem. And so we'll go ahead and start with flexible housing fund data update from Emma.
All right. Myself, Emily is actually going to be doing the presentation on this. Emily is our Flex Fund manager and has been working really hard and making some good changes and helping a lot of folks with this. So Emily, take it away.
Thank you, Emma. Good morning, everybody. As Emma said, my name is Emily. I'm the Homeless Program Coordinator and working with the Flex Fund. Andrew, you can go to the next slide, please. So the Flexible Housing Fund, it's been around a couple of years. Its purpose is to remove financial barriers that households face to maintain or secure permanent housing in the high-cost, low-vacancy rental market. And it assists with our overall goal of engaging homelessness prevention and making homelessness brief, rare, and non-recurring. This fund comes from the 2% marijuana tax revenue that the city gets. Next slide, please. So in 2023, we had a total of 335 applications submitted. Of those, 215 were approved, 111 were denied, and then 9 were withdrawn. The main reason that applications are denied is because we run out of money, or maybe the application or the applicant is from outside of the city of Aurora, so maybe applying from Denver or Boulder, Centennial, those areas, or the application was just turned in incomplete or incorrectly. If that is the case managers do have an opportunity to make changes and resubmit, assuming we still have money in the pot left, or they can the following month. Next slide, please. So the top application categories that we get, number 1 is always eviction prevention. Under that would be rehousing applications, so things like security deposits, first month of rent, that type of stuff, and then relocation through bus tickets. You are able to apply for more than one thing at once, so sometimes that's why the math doesn't always add up. And then some other important data points for that is 183 applications were from single parents. And in 2023, we spent a total of $532,132.70. But we had, about 200,000 more requested. So kind of demonstrates that we're in a pretty big need for this type of stuff. The rest of the application categories: security deposit, first month of rent, rental arrears on a current unit, or we could do a past unit, relocation, like I said, through bus tickets, utility assistance, one-time move-in costs, so things like moving company, application fees, and then hotel, motel stays. A couple things that I want to point out about the relocation and family reunification. we have to confirm that there is a permanent housing situation available in a different city or state. We don't want to just send somebody to go experience homelessness somewhere else. So we do ask for an address and the name of the person that they'll be staying with. For hotel and motel stays, we require that a permanent unit is lined up. We don't quite have the funding to pay for hotels and motels all the time. So we ask to see like a RAFTA packet if they're on a voucher or a lease with a move-in date so that people have places to stay in while they're waiting for that to align. Next slide, please. So applying for assistance, applicants must be working with a case manager, and the case manager has to have completed our training. Trainings happen once a month, and then at the end of each year, we ask all the case managers to do a refresher training just to make sure that everyone's on the same page, and if there's any updates or changes that we need to make, everyone gets that information. The application portal opens on the second Monday of every month. So it opened last week. And typically the fund only stays open for about 2 hours before we've already received more than the applications that we can support. So we have about $45,000 to spend per month, give or take a little bit from there. The fund is in a huge demand and it's kind of the only option right now. So a lot of case managers really depend on this for their clients, and it isn't able to be used in an emergency response situation anymore. It's a lot of planning and making sure that folks are ready for that Monday morning opening to get their applications submitted. Next
Hey,
slide.
Emily,
Yeah.
do you just want to mention why we moved it, the opening from the first Monday of every month to the
Yeah.
second? Because I think that's important.
Yeah, for sure. We got some feedback from the Housing Authority and our landlord recruiter that is contracted through them that's saying opening in the middle of the month gives landlords a chance to post their tenants, and those fees are collected then. So it makes for a more accurate demand letter or ledger when doing eviction prevention. If it's at the first, sometimes folks don't get posted until like the 8th or later, and then they end up having to wait. So when we do it in the middle of the month, it just allows for a little bit more accuracy in numbers and that. Next slide, please. So the agency is trained. We have a ton. Pretty much every service provider in Aurora and then some are trained with the fund. Salvation Army, Housing Authority, the county, the hospitals, the VA, Aurora Mental Health and Recovery. We've got like 200 people out of all of these agencies trained. Next slide, please. The most frequent agencies that are submitting applications are the Aurora Housing Authority, Mile High Behavioral Healthcare, and that's like their whole umbrella. So including Colfax Community Network, Comitis, ADRC. Next, we have Arapahoe County and then East Colfax Community Network. Those are where we're getting the most of our applications from right now. Next slide, please. Another thing to note, we have the Community Solutions Flexible Housing Fund. So it's a little bit separate from our regular flexible housing fund. This is a total of $30,000 to assist veterans on the Aurora by name list move into permanent housing. So being on our by name list means that they're experiencing literal homelessness in the city, and they are part of our case conferencing that happens bi-weekly. This funding can't duplicate services that already exist through SSVF or BASH programs or other veteran service providing agencies. So it can be used for things like vehicle repair, pet deposits, hotel and motels in between, waiting for a lease to be ready and staying in a shelter or outside of a shelter. It is similar to a regular flex fund with it is pretty flexible, and so it's nice to have that. Next slide, please. And that is all I've got for the update on 2023. So thank you for your time. Any questions?
Thank you so much for your presentation. Go ahead and let Councilmember Medina and then Councilmember Murillo go first. So Councilmember Medina, any questions?
No, just, I know it's a high need. I've referred a lot of people to the program myself. And so, yeah, just look at, are we looking at other resources to get more funding? Or is there other ways we can help to mitigate some of that? So let me know. But thank you.
We have looked at some other resources before. We've applied for a few different things to try to add to this. One of those notably was I think the 1377 House Bill 1377 that came out last year, but there was such an overwhelming response to that that not that many communities actually got funded. So we do try. We agree if we could make this bigger and have more funding, that would be amazing. Because yeah, we need that extra assistance for folks. Yeah.
Thank
Thank
you,
you.
Emma, and thank you, Councilmember Medina. Councilmember Murillo.
Thank you, Councilmember Coombs. Just wanted to affirm that the eviction assistance funding is still only kicks in when people have an eviction notice, or it's like kind of in that late stage part of the process. Is that still correct?
Yeah, part of the requirements for we require different documents. We need like a ledger and then a demand notice or notice to quit, something of that nature, to move forward.
Okay. I feel like we've talked about this before, but can y'all refresh my memory on like why we have to or why we wait that long to support folks? Like, I mean, yeah, if you could comment on that.
I can take that. Yeah, so because we have such limited funds, we and it's hard to prove if someone really needs the assistance otherwise. It's really the only way we can get the documentation needed to say yes, you need this, because we're really trying to make sure that we're helping those who are really in need of it, and having that documentation to back it up. A few years ago, I think they did an audit on the Flex Fund. It used to be, it had a different name prior that I can't remember right now, but they did an audit on it and we're saying there wasn't enough documentation backing things up. So this was one of our steps to make it so that we were getting more documentation and saying this is why we're approving these folks. And we'll take the notice as well. So it's not always to an eviction yet. Sometimes it's just like a, hey, this is a warning. And that doesn't always mean that you usually have some time before they're going to court or anything like that. So that's why we take the notice to quit, which isn't really an eviction notice yet. It's just a notice to quit.
I guess I'm not familiar with that specific terminology. At what point, like, does that mean that they have been a couple months behind, or what is that notice? When does that kick in?
Mm-hmm. It depends on the landlords, honestly. Some landlords will do it the second you haven't paid or the second you're behind even a little bit, and we'll post that immediately. Other landlords will work with folks, and sometimes they've been working with them for a while and that person is behind several months at that point. So it really depends on the landlords at what point they post that, because it is up to their discretion. But the notice to quit is just kind of the very first part of just letting folks know that, hey, you're behind on rent. If you don't fix this soon, then we'll start to take legal action. That's the first step. So it usually says on there that if it's not paid by X date, then we'll take this to court.
Okay.
So that's why one reason we asked for that.
Because I hear you on like the audit vantage point, is there any other type of documentation that the auditors would accept? Maybe I'm getting too much into the weeds on this, but there's you're initiating a process with, it sounds like that letter, and then obviously the eviction notice is a little late for some folks too. Is there any other type of documentation that the auditors would accept as proof? Because I agree we should have a way to prove that, but is there any flexibility on that documentation?
This was a couple years ago that audit happened, and I think it was before I was here, so I'm not sure, and I don't think we've been audited since then. on this, to my knowledge at least. So I think that's something we can look into and maybe see if there are other agencies around who have a similar fund and see what they're doing.
Okay.
As long as we're getting the documentation needed, I think we can try to be flexible, but yeah, the documentation is just really key since we have such a limited amount. I think if we had a higher amount available each month, it'd be a little easier to be a lot more flexible because we're getting so many applications that the documentation is really what sets apart each application.
Yeah, well, and like I
But-
think documentation is probably a good idea anyways. But if there's a way to maybe just directly ask the auditors for alternative options, you know, usually I think they're pretty open to offering alternatives. They might even put that in the report. And yeah, I like the idea of reaching out to other municipalities who might have some best practices that they can share with us too. If you could bring that back to the next meeting as just like a quick update, that would be a request on my end.
Sure, we can absolutely do that. Thank you.
All right, that's it for me.
Thank you, Councilmember Murillo. So I guess circling back to the amount of funding, I understand that other funding sources haven't been available. As we're looking at taking a different approach to our marijuana funds, wherein we will not be providing operational funding to the same number of agencies. And I think for the same types of services that we're currently providing, while we're looking at that marijuana fund conversation, as we shift to the navigation campus, could we look at moving some of additional marijuana funds into this fund to account for applications that are denied solely due to lack of funds, right? We wouldn't put additional money in for applications that are denied for lack of documentation or for coming from other cities and counties, things like that. But it looks like there was, almost $300,000 short of applications that would otherwise qualify.
Absolutely. We can look at budgets and see how we can potentially add more to the flex fund for that. Yeah, we'll definitely take a look at that.
Okay, thank you. That's appreciated. And Mayor Kaufman, do you have any questions about the flexible housing funds?
Well, I think it's a great program. I would be concerned about what our costs are going to be in the Navigation Resource Center in terms of the ability to divert them. But and I know that there was a discussion before. We had raised it to State Center Rhonda Fields, but I don't think it went anywhere about the state recognizing the program and providing some funding for it. Jessica, do you remember those discussions?
I do. Yeah, Mayor, and we have not done anything with legislation. As Emily was going through the presentation, we have received some funding from the state for additional flex funding specifically for veterans. So we have applied to the state through their regular processes and grants and ARPA funds for additional funding, but no, we haven't done anything with a legislative request.
Okay. That's all I have. Thank you.
All right, thank you, Mayor. Thank you for joining us this morning. So we will go ahead and move on to the next item. Thank you, Emma and Emily, for the update. We appreciate all the work that you do in this program and with trying to keep people housed in our community. And I know you're doing a great deal with limited resources. So thank you so much for your work. All right, and so we will move on to item 4B, the Ridgeview Residential and Recovery Campus update from Jessica.
Thank you. So this item is an ARPA funding item wherein we would be providing funding to the state $1 million for the renovation costs for the Ridgeview campus. The Ridgeview campus has 3 different components: a behavioral health, addiction recovery component, a federally qualified health center piece for actual medical and dental care, and then a transitional housing program, which also has a vocational and workforce component to that as well. So this is a project that council agreed for ARPA funds to go to a couple of winters ago, and we were working on ARPA funds, and we're now getting to the point of actually allocating the funding to the state through an agreement. So anything that was agreed upon with ARPA, we bring back in a formal agreement. So this is one of those. And essentially we are, the state will be our subrecipient for our own ARPA money. The total renovation costs are 95 million. So we are putting money in. Arapahoe County is also putting in, along with many other jurisdictions, as it will be really serving as a statewide facility, but primarily for the metro region. And just a little bit about how this would function with our navigation campus. So this is really part of the continuum of care with the Potomac campus, where we'll have detox. Someone may go from detox out to here to the Ridgeview for rehabilitation, for addiction recovery, and then reintegrate into the community, either from there as part of their transitional housing, or they may come to the navigation campus. Conversely, someone may come to the navigation campus that really needs that, you know, very intensive behavioral health addiction recovery. We won't have, you know, very specific programs like that as much at the navigation campus, but they may go here if they need to have sort of in-house treatment services for an extended amount of time and come back. So those 3 projects that we funded with ARPA, again, are still functioning together in a continuum, but depending on what people's individual needs are. And I think that's it. Happy to take any questions.
Right. Thank you, Jessica. We'll go ahead and start with Councilmember Murillo. Do you have any questions?
No questions.
Thank you, Councilmember Medina.
No questions at this time. Thank you.
Mayor Kaufman.
Oh, thank you. Yeah, so how many inpatient beds are we talking about now?
I believe they were around 200. So we have an estimated 200 persons can be served in the transitional housing piece, which would be the people on site. And they're hoping to serve an estimated 1,000 patients annually through the behavioral and physical health clinic as well.
Okay, because aren't those supposed to be fairly long-term? It's a fairly long-term, but is it a Fort Lyon model, along the Fort Lyon model, to where, I mean, they're there for 2 years, up to 2 years in that particular model? And
Yeah,
so, okay.
The state has said 6 months to 2 years.
Oh, really? Okay, okay,
So not everyone will be there for 2 years.
okay.
And then some people will be there for a shorter stay as well, that are coming just to seek other services.
So it sounds like they're doing a lot more outpatient than first anticipated.
It seems that way, yes, and we get regular updates from the state. Although given the location, it's not overly convenient to come in just for, outpatient services.
Okay, yeah, I think that its location was great for the inpatient. So that they don't have ready access to what got them there, the addictions that they have, whether it's alcohol or any kind of drug. Okay. When do they project it to be open?
I don't have that, but I can get that before we go to study session. I think they haven't started the renovation yet, so I would say they're probably into 2026 before opening at this point.
Okay.
It's been a very slow process.
Yeah, surprisingly slow.
Yeah.
Okay, that's all I have, Madam Chair.
Thank you, Mayor. So I guess following on from the mayor's question, just about kind of the scope and type of services, I know the original conversation was really focused on longer term outpatient and some of the justification or inpatient, and some of the justification was for the location was that keeping folks away from any type of influences that may negatively impact their recovery. So are there any concerns that have been raised or conversations that have been had about the impact of folks there for shorter stays on that issue? On whether or not that might introduce more possibility of bringing in stuff that shouldn't be brought in, or just affecting the recovery of people who have really, both acute and also chronic addiction issues that are really there for that.
Yeah, it seems that it's still very focused on sort of inpatient, longer term stays. I think, the shorter term stays may be for a couple of weeks or a month or something, depending on what people's needs are. So when we have spoken with them and we've had some conversations with the county as well, it's not intended that people are coming just for essentially a medical service, but they may be coming, say, out of detox and they need just a shorter term stay. So not everyone's going to be there kind of on this longer term transitional housing and workforce type of piece. And then the health center piece is really to support whatever physical health challenges they're having while they're working on their addiction recovery. So it doesn't, from what it sounds like with the state, people are not coming for just an appointment and leaving, but they may be coming for a shorter term where they're not taking advantage or needing all of the services offered on the campus is kind of how it's been described.
Okay, thank you. That's helpful. Any other follow-up questions or discussion? Right, any objection to moving this forward to study session? All right, seeing none, we will go ahead and move that forward to study session. Thank you so much for the update, Jessica.
Thank you.
And then we have 4C, the Family Services and Shelter discussion with Emma.
All right, hello again. I'm actually going to turn my camera off. Just my computer's running really slow, even though I'm in the office. I don't want to glitch too much. All right, so today I'm just going to be talking through some of the family services and sheltering that we have in and around Aurora, just as we've been having lots of conversations about family sheltering moving forward, especially with the navigation campus coming online. So Andrew, please go to the next slide. So just the 3 shelters we have in Aurora that are specifically for families. Comitas Crisis Center. You probably know a lot of what I'm going to be going over today, but just so we're all on the same page and talking through the landscape that we currently have. So yes, Comitas Crisis Center, they do have emergency shelter for families. They have one floor just for families, and they have some other space for families as well through their through TANF, through the counties. I don't think the counties have been sending referring folks to Comitas for some time now, though. And that was due to safety concerns and conditions at Comitas. And they do a monthly lottery, which folks call in to determine if they get to stay. And families can also, call directly themselves. Then we have Family Tree, their goals program, non-congregate for families, referrals made by agencies. We've referred folks there a few times. They always have a long wait list. And they have a few other locations, Family Tree does, around the Denver metro area. And then Gateway Domestic Violence isn't necessarily specifically a family shelter, but a lot of families end up staying there as well. But it's for singles as well. It's not only families. And to get in there, families just need to call their hotline to get a referral. And they have their shelter's fairly small. They have some offsite hotel rooms that they use as well. Next slide, please. And then outside of family shelter, we also have some agencies that just provide some services specifically for families that aren't shelter. So the Aurora at Home collaborative, we have they have a program that's specifically for rapid rehousing of families. So they do some homelessness prevention as well, but I'd say rapid rehousing is what they do more of with that program. So they provide case management, housing navigation. They have a really good landlord recruiter on the staff who is a magician and is amazing at finding units for folks. And that's all underneath the housing authority, but it's a program that benefits the whole Aurora at Home collaborative, and that is referral based, and clients need to have all of their paperwork in order. They won't accept a referral unless they have all of that paperwork, and that includes having like birth certificates for everyone in the family, and identification and things like that. And then Colfax Community Network, which is an offshoot of Mile High Behavioral Health Care. They have their drop-in resource center for families and youth. They're currently still at their old location off of Colfax. I don't believe they've opened their new location yet off of Montview. The last time I drove by it, it still looked like they were working on it. So I haven't gotten an update from them in a while of when they're gonna open that. But they offer case management services, and parenting classes, career development, things like that. And they do sometimes submit applications for the Flex Fund through case managers there as well. Next slide, please. Next slide, please. Sorry, is my computer lagging?
I think you're okay, Emma.
Okay.
Yeah, but the PowerPoint is gone now.
Yeah, okay. Andrew, are you having trouble pulling that back up? I can pull it up if you are. Give me 1 second.
While we're waiting for just a quick second, I know that Mile High has been moving into the Montview facility, moving all the furniture and everything in. So they'll be ready to open pretty quickly. And we'll also have a food pantry and counseling, both individual and group for families and youth on site at that facility.
That's great. Councilmember Coombs, did they give you a date that they thought they would be opening?
I assume I'll be getting that update at the board meeting on Tuesday. But I know that they started moving in during the snowstorm. So it shouldn't be terribly long. So I can provide an update after Tuesday's meeting.
All right. And let me get back to my slide. All right, can you all see that? Great, okay. There are also some family options outside of Aurora that will serve anyone in the Denver metro area. They don't have to be from Denver or from some other municipality. So we can always refer folks to some of these, and we have many times. So Sacred Heart House of Denver, they offer stabilization services for families, and then they have referrals to permanent and transitional housing. And then the Family Promise of Greater Denver partners with different congregations, and they provide emergency shelter, and they have case managers, and families can apply themselves online or they can call. And then Salvation Army has two different options. They have their Housing Now program, which does rapid rehousing. They also do some homelessness prevention. And those referrals come through the coordinated entry system, which is through the COC. Metro Denver Homeless Initiative. So that does need to go through generally HMIS and that whole system, but that's where those referrals come from. And then they also have a few family shelters. One of those is a Lambeth Center that's way over on Federal, but they'll take, again, referrals from anywhere. And that's a transitional shelter for folks. And then they have the Connection Center, and families can be added to a few of their different wait lists for different sheltering. They have some other hotels that are specifically for families as well, and that's all through the Salvation Army. And the Connection Center is actually on the same site as our Safe Outdoor Space on Peoria. It's in that same building. It's just upstairs. So that's pretty easy access for folks in Aurora for the Connection Center, but folks can also just call or go online to access the Connection Center as well. So that's just a few options outside of Aurora that we can and do refer to for folks. And then just some expansion plans, things coming up. Goals is working on expansion right now. I know they got funding from Douglas County to expand the goals program. So they're working on that. And we've talked to and heard from a few different organizations about looking to purchase hotels specifically to make into transitional housing for families. One of those is the FACTS partnership. They've been looking at doing things like that. Children's Hospital has been looking for something along these lines for a while as well, of potentially getting some kind of hotel to have their families in temporarily. So there's a few other organizations working on things like this as well that we're kind of in the loop on. And I think that's my last slide. Yeah. So this was really just a quick landscape so that we're all on the same page of what's going on and what we do have, so that we can all talk about what our future options can look like, and how we can be moving forward with family sheltering. And yeah, just making sure we're all on the same page when we're talking this through moving forward. Questions?
Any questions, Councilmember Medina?
Yeah, just a quick couple. On the Comida Center, how many families are there and what is their length of stay there?
Ooh, let's see. It depends because they have those two different floors. So there's the floor for the TANF folks. That's a longer term stay. And anyone correct me if I'm wrong on this. I haven't been over there in a minute. But I think that's up to like 6 months with the TANF floor. And they have like non-congregate rooms for those, but only a few of them. I think it's even just half of, if you've been to Comidas, they kind of split the floors in half. So just half of one floor is for those TANF families. So I think that's probably around 8 rooms maybe for TANF families. And then the top floor, I believe, is families, and that's their congregate sheltering, and that's really like night by night with a lottery. So folks aren't guaranteed like a long-term stay in that one. And I'm not sure how many. Again, that's just half of a floor as well, I believe. So and they have bunk beds in those rooms for families. So probably 4 or 5 rooms with probably like 6 bunk beds in them each. Yeah.
Thank you.
And I'll just say, in addition, in light of not planning to have singles there anymore after 2024, due to council decisions, the plan at this point is to increase the amount of space available for families. And I am also aware that Adams County has resumed sending families through the TANF program to Comidas, and Arapahoe has as well, but in a very limited capacity.
Great, thank you for that, Councilmember Coombs.
You're welcome. And Councilmember Murillo.
No questions on my end.
Okay, thank you. Mayor Kaufman.
Thank you. From time to time, I get complaints about Comitis, and some of them don't seem legitimate. Typical, I don't get along with staff stuff. And others, I'm not sure about. But what is the problem just that it's an old building and it wasn't designed for this purpose, or what is your estimate of Comitis of Comitis?
I think sheltering is hard no matter where it's at, no matter what kind of building it's in. The building is definitely, I think, does make things a little more difficult sometimes. It is old. And I think sometimes has fallen into disrepair. I went on a tour there, I think, late last year, and it was in some pretty bad disrepair, and the cleanliness levels wasn't great. But I know we let them know about that. We talked to them about it, and I think since then they've cleaned up a lot more and have done some repairs on a few things. So they were really responsive when we talked to them about that. And otherwise, I think, yeah, you'll always have some folks who don't get along with staff, but I think one thing I've seen is lower staff levels make it harder when you have that many people in one building. So I think there's a variety of things that can happen with that.
And then Emma, just the safety is usually what we hear about. So, for example, when we went over earlier, I guess in 2023, the magnometer was, not functioning and not being utilized. That building is hard to have positive control. There's multiple entrances. People have to leave during the day and then come back in. So families are mixing with singles outside as they're waiting to come in. And so there's some either real or perceived safety issues around that. And then the separation within the building from the single adults and then families is also, there's not a separation with a secure barrier there. And so those are often some of the things that we hear about. Locks on the doors aren't working, locks on the bathroom. And so families feel uncomfortable there. So those are some of the things that we typically hear about. We always follow up, and that's only one side of the story when we hear those complaints from the clients. So we have worked through those over time, but certainly the design of the building and having adults and families all together presents challenges. So if the whole building could just be families, I think we'd be in a much better position to make people feel welcome and safe.
Right, so thank you for that, and I will certainly follow up on those issues, as the board representative from council. I know a lot of them have already been under discussion, but I'll check in and just kind of see where we're at. Obviously, there will not be singles there anymore after this year, so that'll potentially address that issue. Mayor, do you have any further questions?
No.
Councilmember Coombs, can I ask a question really quick?
Yeah.
Of you?
Yeah.
So I know they have the single floors and they have the family floors, but there's also the floor that is for single adults who are in recovery, and there's the veteran GPD floor. Do you know if those will continue after?
I don't know that any definitive decisions have been made at this point. I know that's under discussion because, again, the adults and families in the same building present some challenges. And particularly, I know was one of the sources of safety concerns from the county in terms of Arapahoe County in terms of sending families over there. So as we're continuing to have those kind of strategic planning conversations moving forward, and now that we know for sure where things stand, I'll ask about those issues, kind of those programs and what the plan is for those programs. I think the other piece is just also looking at funding, staffing levels, what can be accommodated with the funding that is available, as well as fundraising that will be undertaken in light of the current funding situation. So I'll definitely let you know. Again, we'll have a board meeting Tuesday. If I don't get those answers in the board meeting, I can kind of follow up to see where we're at on those questions.
Thank you.
And then I have some questions. One is with respect to the Aurora at Home landlord recruitment. I know when they're sending folks to multifamily properties, those properties have been inspected under our multifamily systematic inspection process. But I have had some pretty significant complaints about the habitability of some of the single family homes that folks have been referred to through the landlord recruiting program, including like severe mold, severe infestations, just generally very extreme habitability issues. And so is there any process around inspection for single family homes that are a part of the Aurora at Home landlord recruitment process? And if not, is that something that we can look into?
To my knowledge, there's not a formal inspection of those single family units. That's definitely something, yes, we can absolutely look into that. I wasn't aware of those, so thank you for sharing that. We want to make sure folks are being placed in safe units that are going to be good for their health. So yeah, we work really closely with the housing authority and with that landlord recruiter, so we can talk to them about that. If you're able to share any of the units, I think that would, if you have them, I think that could be really helpful in talking to them about that as well, because it could be that it's specific landlords that are maybe not taking care of their units. But
Yeah,
yes,
and I'm pretty
we'll look
sure
into
that in all cases they have made complaints to code enforcement. But yeah, and I'm sure at least one of them Jessica's probably aware of, because I think we've talked about it. But yeah, we can follow up and I can provide some more information. I think at this point the folks are already no longer living in those units, so I don't think there's any kind of safety concern for them with respect to that issue. So, and then the other question is just, do we expect any issues coming from Denver around sending folks to a variety of programs in Denver in light of the fact that we have asked them to not send folks to Aurora? Have there been any conversations raised to you all about the need, for example, of a good neighbor agreement where we're also reporting to them and asking and communicating with them about the impacts to their city of us sending folks experiencing homelessness there?
So we're not sending folks to any of the really city-run facilities that we're talking about. All of those that we mentioned were Denver Metro-wide agencies, and some of them may just happen to be in Denver, or they're on the very outskirts of Denver, or even Lakewood. So we haven't been communicating with Denver on that. Because we reach out directly to those agencies. I don't think we're sending folks over there frequently enough to really make an impact on Denver's sheltering system. If it ever got to that point, then yes, we would want to be in contact with Denver about that, just as we would want them to be in contact with us. But we're getting folks coming from Denver a lot who maybe just cross the border into Aurora and they come to Comitas, and I'm sure to Gateway as well, and to some of our other shelters. And we're not currently asking them Denver to send us anything like that or let us know when folks are coming over. So I don't see that as an issue at the moment. Like I said, if we start seeing larger volumes that we're trying to send to Denver, yes, we would definitely want to be in contact with them about that, but I don't foresee that happening.
Okay,
And
but so in light of our
similar-
resolution, they haven't said anything to us about wanting that type of conversation.
We also share with Adams County a lot. Like Adams County has Almost Home and they have programs that we don't have. And then Adams County will also, send folks to us. So, in the regional nature of things, it's more than just Denver where we are sharing resources, especially for families. If there's a program or something that meets a need, we want to make sure that they get referred there appropriately.
Okay, and so we're not asking them to provide us with anything when they have families coming here, and they're not asking us similarly, either Denver, Adams County, or any of our other regional partners.
No.
It would be up to the service provider to be asking those
Mhm.
questions because we don't take anybody as the city. So that would be up to Comitas to ask, where are you coming from and tracking exactly where someone is. And we do that through HMIS. Where did you sleep last night? Or where is your last place of residence? Those kind of questions.
Okay, great, thank you. Mayor Kaufman?
Yeah, I know the resolution created alarm, but as it was introduced, unfortunately, there was an amendment that took that part out of it. And I tried to talk to the sponsors into holding back and letting me work with them and rewrite it, but they decided not to. But our Navigation Resource Center will one stop will serve the entire metropolitan area. So, but I think that's always a concern.
Okay, so really, at this point, we're just kind of in any of these relationships, the conversation would only become relevant if we were having a larger number of folks either going to another city or county or coming into Aurora from the cities or counties. Kind of what I'm hearing.
I think so. Yeah, if we're seeing it make a huge impact on the availability of units for our own folks, then yes, that's more of a conversation and vice versa.
Okay, thank you so much for that. Are there any kind of questions, thoughts, ideas that folks have in relation to family sheltering in light of the information that's been provided? I guess my question is just with respect to capacity. I think we will not be, or well, it's not clear, right? We haven't had a conversation. Are we going to continue to fund Gateway for families specifically? Are we going to continue to fund Family Tree after 2024 for families specifically? Are we going to provide any family related funding to CCN or Comitas after 2024? And those are the within Aurora programs that are providing those services. So are we going to provide any funding to address the need for family sheltering, one, and two, kind of what is our total capacity for families, and then what kind of capacity is being absorbed by those outside of the city providers?
Yeah, as far as funding goes, I think we have funds outside of just marijuana funds. We get ESG, we get home TBRA, even some CDBG can be used for sheltering sometimes. So there's some different options that we'll be able to look at, and I think we'll know more as well once we get final numbers for how much marijuana funding we're getting in. And as we're moving forward, working with our operator of the navigation campus, we'll be getting better ideas of how much they're bringing on board for funding as well. And we're working to find funding elsewhere with other agencies and foundations to help fund the navigation campus. So I think there's going to need to be some level of funding of some of these family agencies, exactly as you're saying. and how that's coming out. We don't know exactly what that's going to look like yet, but that's conversations exactly we're having with you and we're having internally as well with staff and looking at how that's going to be happening. I just spoke with Carmen from Gateway last week about looking at next year and what that's going to be looking like. So yes, those are conversations we're having. I don't think we have solid answers for all of those yet, but we're not just going to let it fall to the wayside and completely ignore it. We know family sheltering is important, and that's something we're working on. And we're encouraging other agencies to be applying for funding elsewhere, and we're hopping on with those and helping them with those applications when we're able to, and providing recommendations for that as well. I'm constantly looking at different funding opportunities that we as a city can apply for to be able to fund some of those other agencies as well. And the state's coming out with different funding occasionally that we're able to apply for. So we're keeping our eye out on that. Jessica, did you want to say anything else on funding? If not, I'll move on to the capacity.
No, I think just as we probably get into summer, we'll have an idea of revenue coming in and then can create some recommendations so that we're aligning with the budget process for what stays for family sheltering coming from the myriad of HUD sources and marijuana sources, and then what is more aggregated and transitions into the navigation campus. So I guess from a just recommendation standpoint, we would not fund anything in family sheltering, but we may have, additional reductions depending on revenue coming in.
Okay, thank you. That's helpful on the funding piece. Mayor, did you want to jump in and have a question about funding, or is this after the capacity conversation from Emma?
Funding.
Okay, go ahead.
Yeah, to what extent are our county partners putting up resources?
So Adams County and Arapahoe both put some funding into Comitas, and that's mostly through their TANF programs. I know Arapahoe County funds a lot of the goals program, and Douglas County, as I mentioned earlier, even put in some funding for the goals program expansion. But that was only for the, I think, construction portion. I'm not sure if they've committed to any operational funding for that expansion as well. Adams County doesn't do anything for goals since that's in Arapahoe County, so far into Arapahoe County, but Adams County also with their SWAP program, that's their emergency weather. They've started providing us with some hotel vouchers that we've been able to house families or in hotels during severe weather as well. So they're providing a little bit of funding in that way as well. So we are getting funding from different sources from the counties. And that's one thing I think, we'll be asking them to continue to do and maybe step up a little bit more as well. And that's part of our conversations that we're having in that Aurora at Home collaborative. Both counties are part of that collaborative and have been coming and participating in that. And that's a big topic that we're discussing in those meetings as well.
Good.
Thank you, Mayor, and thank you, Emma. And then just with respect to the capacity question, if you want to go ahead on that.
Can you clarify exactly what are you asking, like how many beds we have, or exactly what are you?
Right, how many families are we able to shelter at any given time within the programs that are in the city of Aurora?
We might have to get back to you with that number specifically and look at some reports just so we're accurate in our response, because there's 3 or 4 different agencies, if that's okay.
That's exactly what I was going to say, Jessica. I don't have that number off the top of my head. Yeah,
absolutely. I think, this is a preliminary conversation. So as we're moving forward, if we can just kind of try to assess, does the capacity that we currently have match up with the need? Do we have a gap? What can we do about that gap? What partners can we be trying to work with? And what funding sources can we try to pursue outside of just our marijuana and HUD funds in terms of providing that sheltering and making sure that we have enough capacity?
Absolutely. We'll get that number.
Great, thank you. Are there any other questions or points for discussion with Emma and Jessica on this? Right, seeing none, we'll go ahead and close out this item. Thank you so much for bringing this to us today, kind of getting this conversation rolling, and look forward to just continuing and figuring out how we're gonna put all the pieces together. All right, so then miscellaneous matters for consideration. I know Councilmember Murillo had a change to the minutes that she wanted to go ahead and make.
Thank you. I missed that part of the discussion, so if this is redundant, I apologize. But I just noticed that the kind of header where it discusses members that are present was inaccurate. It says that I'm the chair, that Councilmember Medina is the vice chair, and that Councilmember Marcano is still on the committee, which is inaccurate. So we just need to make sure that that is updated, and maybe it was just a carryover from like a former template, and making sure that if we're referring to council members in the body of the text, that there wasn't a mix-up there. But I don't think that was I think it was just like the header, to be honest. So just want to make sure that was corrected.
Thank you for catching that. I did not notice that. Thank you, Councilmember Murillo. So we'll go ahead and approve the minutes with that correction included. Okay, so then any updates from community members? If you would like to give an update, raise your hand. All right, I do not see any. Oh, wait, there's Rochelle's hand raised. Rochelle, go ahead.
Good morning, everyone. Thank you for giving me a moment to speak. I just wanted to clarify just a few things in the conversation. I wasn't able to get into this meeting at first, so I was on the phone, so I wasn't able to raise my hand. But I did want to let everybody know for Comitis, we are on a waiting list for our TANF floor. The entire second floor is TANF. We are getting referrals from Adams County as well as Arapahoe County. And we, like I said, we are on waiting list at this point. And then CCN has moved into the new Montview location. So we actually started with kids yesterday for the CCN program. So super excited. And then we are working on the finalization of getting the adolescent behavioral health there as well. We are in agreement that we think it would be a very positive move to have Comitis become an entirely family shelter. That would be our desire as well. We do house veteran families on the third floor. We have the emergency family on the other side. So half the floor is VA, half the floor is emergency family. Second floor is all TANF families. And then the first floor right now, of course, is singles, UC Health, and then the ORU. And if we're going completely to a core family shelter, that would definitely open up additional options for families. We also work considerably with Children's Hospital. So we provide a lot of support to homeless families that need sheltering for their children in order to be discharged from the hospital. And we've been working with them also on the possibility of earmarking some specific rooms moving forward specifically for them versus us just matriculating in as we can for them.
Thank you so much, Rochelle, for clarifying those points. I thought that the that the hope was to kind of only do families at Comitas, but I wasn't sure where we had landed on that at this point. So thank you for that, and exciting that Montview has folks actively being served there as of today. So thank you for that update as well. All right, any other updates from community members? All right, seeing none, we will adjourn, and thank you everyone for joining us.
Thanks. Have a good day.
Yep, have a good day, have a good week.
Thank you.